So if you get TMJ pain, jaw pain, neck pain, headaches at the end of a workday or while you're working at a desk, this information is going to be very helpful to you. Posture is king when it comes to that stuff, though it isn't particularly super sexy. So we're going to show you guys how to address your posture with 3 simple techniques that you want to do often to get the most benefit out of them. So a lot of our postural problems come from stiffness of our upper back. If you reach back, the back of your neck, from right where your fingers can reach down to the middle part of the spine, right here, this area is called your thoracic spine. And stiffness in that area, particularly flexed forward stiffness, causes lots of problems with our neck and our jaw. So we're going to address the joints in our spine, and we're also going to address some of the musculature, both stretching out the pec muscles, which they roll us forward, and also we're going to work on some of the strengthening of the back of the rotator cuff and the shoulder blade muscles. So for this technique, I like to use a half foam roller or a full foam roller, but if you don't have that, you can always use like a stiff rolled up towel or something similar. So we're going to use the half foam roller. We're going to place it down on the table or on the floor in some cases. We're going to lean back. And I'm going to take a deep breath through my nose. Relax through it. Now you might feel some like pops and cracks. That's all right. Also, you're going to feel it pulling across your chest. We want that. We want those arms to drop back because we're trying to stretch out the muscles in the front of the chest and the joints in the back. And then after I've done it for 1 or 2 breaths, I'll move a little bit. So I'm going up higher toward like that hump that we have in the back of our neck. I like people to do this for about 2 or 3 minutes for a few breaths. So next we're going to work on wall angels, or what like my patients like to call them wall devils, because they're difficult. They're not painful, but they're hard, because this works on both the strength and the mobility. So you're going to bend your knees slightly, your head, shoulders, low back, and the back of your arms, including your wrists, are all going to be against the wall. With me sitting in this posture, keeping my back flat against the wall, I'm going to slide my arms up as high as I can go. Hold them up there for 6 to 10 seconds. Bring it back down. Repeat it 6 to 10 times. I definitely like this after you've already done the technique we just showed you, because you're going to get the most benefit from it. Okay, so for the last thing we're going to do is we're going to work on the muscles, the strengthening of the muscles. So the posterior rotator cuff, which are back here, and also the scapular muscles in between, which are in between our shoulder blades. So what we're doing with this one, real simple, your arms down to your side, make sure you're not shrugging your shoulders up. You want a nice like long neck position. You're going to rotate your arms outward. And again, I'm keeping my tongue on the roof of my mouth. Breathing through my nose. Repeat it 10 times, 3 sets of 10, 2 or 3 times a week. So give this some time to work on your posture and strengthening. At first, those muscles are going to be sore. That's normal. That's what happens when we strengthen muscles we haven't used. And this will help in the long run to decrease that pain that you have when you've been sitting. If you find this information useful and you want more guidance on how to manage your TMJ at home, check out the link in the bio, take the quiz we have, and see if our program is right for you. Thanks, guys.